It's not even fall yet, and health officials are already bracing for three major viruses that may all start spreading at the same time across the U.S. This morning, Mandy Gaither tells us about a new weapon in the fight against these viruses.
Excuse me.
It's another potential triple threat of viruses: the flu, COVID-19, and RSV. All three may hit the U.S. together this fall, but this year there's a vaccine for all of them. When to get them varies based on age.
If you're under the age of 60, before Halloween, you should get your flu shot. Late September for COVID, that's when that new booster is expected to come out. It is not an exact match for what is currently circulating, dominantly circulating in the country, but it's still good protection, especially for people who are vulnerable.
The U.S. is already seeing an uptick in COVID-19 cases, although it's still unclear exactly how many cases, as fewer tests are being taken. There are patches of the country in red, with a more significant increase in hospitalizations, a few states with numbers going down and others staying stable. Still, COVID-19 hospital admissions are lower than in years past.
The numbers are going up, but August of this year right now is about a quarter of what August of last year was.
The U.S. Centers for Disease Control and Prevention say if you test positive for COVID-19, isolate for 5 days. On day 6, isolation can end if symptoms improve. The agency does recommend masking until there are 2 negative tests taken 48 hours apart.
It's a little complicated, but really the first 5 days, that's when you're most infectious. That's when you should stay home.
For Health Minute, I'm Mandy Gaither.
Experts predict illnesses like RSV and the flu will settle back into their seasonal patterns this year. COVID-19 cases could have a winter surge, but many experts don't expect it to reach the heights of recent years unless the coronavirus throws us a wild card in the form of a new variant. All right, still ahead.